Welcome to the Stress Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon. And check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD.
All right, everyone, welcome back to another episode. And today I'm joined by Dr. Parul Dua Makkar, and I'm super excited about finding out her story and how she became a dentist. And she's got a lot of other things going on other than just her dental practice. Parul, thank you so much for joining us.
Thanks so much for having me today. Thanks, Eric.
Parul, let's start with how you first decided to become a dentist.
Sure. So I think I was always drawn to the medical, and I think some of us are. But what I enjoyed about dentistry was giving me that flexibility about having my practice and a family life. You know, I've watched some of my family members being on call, being a doctor, being away, and I didn't want that. And there's an instant gratification with dentistry. You know, even today, I just finished seeing patients, and I had a patient who'd broken a tooth, and we got him out of pain. He's like, I'm traveling, I'm moving out of state. I just need this out. And just giving that patient, whether it's, you know, fixing a chipped tooth in the front, getting them out of pain instantaneously, something that, you know, ER will not be able to take care of. And there's an intense job satisfaction that comes with it. And the ability to be validated for what you do instantaneously. And I enjoy that part of dentistry. So, yeah.
And where did you go to dental school?
University of Oklahoma, down south.
And after dental school, did you associate for a while? Did you open up your own practice? What happened there?
So I had a little backward turn somewhat. So I'm I consider myself a modern day nomad. I've lived in many places. But at that point, when I finished dental school, my parents were settled in Canada. And so I moved back to Canada, and I took my Canadian boards, and I worked there as an associate. And then I moved to New York after marriage. And for my New York license, I had to complete a GPR program because I hadn't done it written. And in 2007, when I had moved latter half of 2006, they were no longer accepting clinical boards. So I actually went to GPR after being an associate in private practice. And then eventually now I have my own private office. Yeah.
What was that like going from already being a practicing dentist to having to go back to school?
You know, hindsight's always 2020, and I wish I had done that prior to going into dentistry going as an associate, because GPR or AGD, any of those programs really provides you with a step up, you know, even though we did have a lot of clinical practice, but, you know, still having that safety net as you are becoming good at what you do. And, you know, it's a practice of dentistry. The more we practice, the better we become. I think it gives you a unique edge. And in hindsight, I should have done it right after dental school instead of going straight into being an associate and thrown into deep end. So it was a different mindset walking in. Luckily for me, there was another resident who had been in private practice 5 years, and he wanted to do pediatrics. And so he did GPR and then went into pedo. So luckily I had somebody who is in the same boat as me. But, you know, it was a learning curve. I should have to answer to somebody, but I still was, because I was an associate, never had my practice. But yeah, I would have done it, you know, had I known the benefits of it.
I totally agree. And yeah, when I got out of dental school, I graduated with the bare minimum clinical skills, and I didn't know how to talk to patients. I didn't know how to communicate. I didn't know how to communicate with staff. I really didn't know anything. And I did a residency after dental school for 2 years, an implant residency, but I still even then struggled for years to really hone my clinical skills and hone how I could talk to patients. So I agree. I feel like, after dental school, or just most of us just aren't quite ready for private practice.
Right. Especially if you don't have a private practice to go to, like, if you have a parent or sibling or somebody who kind of can show you the ropes a little bit, and you're really thrown into different associateships that may not be the most beneficial for you, or just the run, how you want to practice, right? You're just developing your skills, and you're still developing the kind of practice you want to have, the patients you want to see, the demographics, the kind of dentistry you want to do. There's so many aspects, and I think we fail to recognize that when we're fresh out. We just want to, we got the doctor title, we want to go to work, and it's just taking a step back and really focusing on those things first.
So I'm actually on your website right now, and it's parulduamakkar.com, and it says speaking, about, book, events, blog, media, dental practice. There's so much that you're up to. Tell me about your why it is you do what you do.
So when I became a dentist, my younger brother and my only sibling, the year I graduated dental school, he graduated high school. And, then he went off to college, and he was trying to figure out and I was practicing in Canada, and we lived together in the same house. And, he's like, yeah, I think I can do dentistry. He observed me, and he followed my footsteps. He went to UBC, University of British Columbia in Vancouver, and became a dentist following my footsteps. And unfortunately, he was diagnosed in 2019, just before COVID. He was diagnosed with stage 2 oral cancer, squamous cell carcinoma. And eventually, it was metastatic. It was very aggressive. And he died at the age of 34 in 2021. And when that happened, it was right, we were still kind of at the tail end, or is not quite as much into COVID, but still in the COVID era. And it was such an unpredictable time. And I didn't know what to do. Besides, I couldn't blame anybody. At that time, I was in New York. He was in Canada. And so as an outlet, I started educating and talking more about oral cancer. And that's my why. I couldn't save Manu as a big sister, as a dentist. It was my job to protect him, and I couldn't. And I didn't save him with an earlier diagnosis. So his got missed because he was put on medications without having a biopsy. And so this led to me talking and educating dental professionals, like, hey, pay attention, get that biopsy, don't medicate without knowing what you're medicating for. So what if you get a false positive? 80% of white lesions are benign, they're nothing. But you still have that 20%. And why it's so critical? Like, we are at the forefront as dental professionals. You're not only dentists, but dental hygienists, even the front desk person, talking, like, when you say the word biopsy, they're going up front to the office manager, and it's like, oh my God, the doc told me to get a biopsy. I'm freaked out about it. I didn't want to tell her, but I'm telling you, who do you think is a good surgeon to go to? So the entire office kind of gets involved. And so it became my mission to, like, let's change the narrative. Let's do something positive for the world. And that's where I got started on this journey.
Do you think that often patients are not told to get a biopsy because the dentist just fears having that conversation with the patient? And do you advocate for this conversation to just happen more often, or the dentists actually do more biopsies themselves?
Yes. And you hit the nail on the head. I mean, yes, to learn to do your biopsy. I mean, if you as a dentist are placing implants and are doing surgical extractions, which I do in my practice, what's a biopsy? You can do a biopsy on, a cheek, on a, maybe not the floor of the mouth, but you can do the tongue. You can do a lateral border. You can do simple stuff, maybe not the soft palate. You can do the hard palate. So I would totally And I got educated. I took courses to do biopsies because I want to offer it to my patient, right? Patient will, push the biopsy out there like, oh, I'll do it after this weekend, after my vacation, after this event is coming up. I'll do it after, because everybody's scared of the word. And so, yeah, I definitely advocate to learn how to do it, especially if you're doing all these procedures in your office and you're comfortable doing surgery, because the quicker we can get a biopsy diagnosis, the quicker the patient gets treatment, and the more effective we are in treating and saving lives. That's really what it is. Because number one reason that dentists get sued is periodontal disease. But the second reason is failure to detect oral cancer. Yes, it's a scary topic to discuss. And this is why I created, the Do a Good Job Symposium, as in giving oral cancer a comprehensive view. It's more than just sending a patient off to biopsy. It's treating people afterwards, how to talk, how to practice empathy as a provider, nutrition or home care, fluoride trace. Like there's a whole aspect to oral cancer that we just, like many other things, we don't learn about practice management in our, in dental schools. We learn the basics of oral cancer, but we don't really learn how to deal with somebody who has cancer. And cancer in general is prevalent in our world. And, it may not be that your patient has oral cancer, but they have some other breast cancer, prostate cancer, which can metastasize to the jaw. So it's essential. This is our field. We should know it. We should be talking about it.
Tell me about the symposium. Is this something you have yearly? Is it just for dentists, or should dentists bring their team as well?
Yes, CEs are provided for all dental professionals. So whether you're an assistant or a hygienist or any specialty of dentistry, you can attain CEs. It's an online webinar I created with 20 speakers from around US and Canada, different experts in their field. So I have, from screening, knowing the oral systemic links, I have surgeons in there, I have a dermatologist talking about wound care, because you get, with head and neck cancer, you get a lot of wound care, survivor stories, and some inspirational speakers, coaches as well. Even have a lawyer talking about, end of life decisions sometimes, and how do you do estate planning? You shouldn't have to take cancer to do that. I remember having that conversation with my 32-year-old brother at that time, when he was going in for surgery. And so these things that we don't want to talk about, but we need to. So it's a webinar. Everybody can access it. It's available online at doagoodjob.com. And it's intended for all healthcare professionals, because there's such a disconnect between between the body and between the mouth. There are ENTs, your general physicians, who don't know the risk factors, who don't know what it is, and how we can work with our profession, with different professions, like OBGYNs that are diagnosing HPV positive patient. Well, you know what? Maybe you have a conversation that their partner is at risk for oral cancer because HPV rates are higher, with your pediatricians to get the HPV vaccine. So, there's a lot of correlation that we can be doing with our healthcare professionals. And so that's what the intent was, to bring all these different speakers together to create something that's not there, and it's joining the dots,
Oh, that's great. Congratulations on getting that started. I think that's such a needed subject. Now tell me about your book. And did I get this right? Life Interrupted, Dr. Dua's Survival Guide. How did that manifest?
So that book is actually my brother's work. He wrote a series of blogs. He was fighting cancer. Like, it came back twice. He had chemoradiation in summer of 2020, and he was 34 at the time. And he said, you know what? I've had 2 surgeries. He had initial surgery was removing half his tongue. He had to learn how to talk again, speak, and chew. He had a neck dissection, lots of scar tissue, radiation burns. And then he had the second surgery in April of 2020, just when COVID hit. And because his cancer had returned, he decided he's going to quit dentistry. He had to start a practice in Calgary. And once he did that, he didn't have any outlet because with COVID, all his treatment was done, chemo radiation was done in isolation.
Mm.
Funds were limited. Canada was like a super lockdown. There was even more restrictions than in the United States at that time. And being immunocompromised, he wasn't allowed a lot of visitors. So as his health declined, his outlet, his brain was still sharp. He would write, and that was his outlet. And he told me in December when I visited, he said, I really want to get this book published. I said, sure, work on it. I'll get you a publisher. And we did. And he, in February of 21, he said, I know you got a publisher, but I really want to write more. I'm not ready yet. I have time. I'm like, no problem. And unfortunately, his passing was very sudden and quick. And when I went to his house after his death, there was the Dental Town magazine with his article, the March edition of 2021, Leaving Dentistry This Way Out. And my mom looked at it and she said, well, he found a way out of life. And it was just that moment where I'm looking at his writing. I knew what article he was going to, he showed it to me. And I'm looking at this magazine and I picked up his mail, walked into his house, and everything was the same, but his life, was interrupted. Like dirty dishes were still in, his blanket, his medication, and his life was interrupted. And that's where the title comes from. He called it his survival guide, the writings. So I put them in the chronological order. I was like, I couldn't do anything else for you. At least let me do his last wish. And I put the book together. So the book is his notes. And then the epilogue is my take on how he became who he became, because I saw him enter the world. I've changed his diapers. I saw him take his first steps in, walking, and how he exited our lives. And so that's what the book's about. And he talks about life lessons while facing mortality.
Wow. And if Manu was still here, what would you say?
Oh my gosh. If Manu was still here, I would be like, I wish I spent more time with you. And when he first talked about his cancer journey, he was very vocal. He talked about it in Dental Town. He publicly announced it, shared pictures. And we as a family were very upset because he was featured in that magazine for his, on the cover for his practice. We're like, and I think that's more of a cultural thing, that you want to show only your best and you don't want to share the worst. And at the time of his cancer journey, the initial stages when he was diagnosed, we're like, why would you talk about your cancer and all your scars and all of that? And he's like, you don't understand what I'm going through. I would tell him, I get it. I get it now, what you were trying to tell me. I didn't understand you then. And I just wish I had more time to spend with you.
And now what about what you were going through? The whole challenges of a grieving healthcare provider.
So I found my grief very isolating, being away from my family. My parents lived in a different country, in Canada. It's not drivable where they live. They're in Calgary, which is the other coast from New York. And I didn't have I actually lost my grandparents too, in the same year as Manu. So it was a lot of grieving without anybody to share it with. And because I've lived in different parts of the world, nobody around me knew Manu from when he was a kid or share stories. And I think that's part of the grieving. You need a village. So being COVID, isolation, compounded with being away from my immediate family, I found myself alone. And it was learning to put myself first, to acknowledge my feelings, to process my loss, and then showing up every day, showing up as a mom, showing up as a wife, as a dentist. When your patient's complaining about a bite check or, food stock or something trivial it may be, and you're like, I just cremated my brother 2 weeks ago, so I'm not quite processing this quite, and you still have to be present and mindful of what you're doing in your profession. So I had to find my way to channel that grief into doing something good. And the book helped, sharing him in the world, as well as speaking about oral cancer. I'm making a change, saving others' lives, hopefully. And And it led me to meeting amazing people who felt validated and seen. And I think that's what it is with grief. It's very easy to say, I understand what you're saying. Oh, God, this is God's plan or whatever. That are meant well, but may seem very insignificant or very poorly executed, if that's the word I'm trying to look. It's insensitive sometimes. And it's just because some people don't know what it's to lose a sibling or a parent if they haven't experienced the loss. And grief can be very isolating, and it shouldn't have to be. I think it needs to be shared. It needs to be openly talked about. And when I talk about oral cancer, there are people, I just spoke at SmileCon, and even afterwards, people came and hugged me, and strangers who are in tears, and they're like, thank you for giving it a voice, because I lost my sibling 10 years ago, but the loss is still as, it's as hurtful as was the day one, because grief doesn't have a timeline and it can hit you at any point. And we as healthcare professionals are always we give up, bathroom breaks, we give up lunch hours, as dentists, we're always trying to take care of people with like immediate dental needs, which they can't do at the ER. Like, you have to take care of the patient right then and there. And somewhere in there, we don't want to lose ourselves. And we're constantly giving as healthcare professionals. So, there's an art to grieving. I had to learn it, and I had to figure it out for myself. And I got a lot of help, and I'm hoping to share that help with others.
Yeah, I was going to ask you that art of grieving that you learned. Do you coach others now? Do you have a coaching program where you help other health professionals going through the grief process?
Yes. I do have a grief coaching program where people can work one-on-one or in a group. And I am getting certified as a grief coach as well, so to have more tools under my belt. I think working with somebody who's traveled and knows the walk, and how some days are better than others. And I'm not afraid to admit it, I've had anxiety, I've had panic attacks, I've had the fear of what tomorrow would bring. When you think life will go a certain way, you never think you would outlive your brother of almost 10 years, who was otherwise healthy and played rugby. Like, you never imagined the world to your life to turn out the way it did. And things don't often necessarily go as planned. And it happens with marriages. A spouse gets diagnosed, or a parent, or even yourself. Grief doesn't have to be the loss of a loved one. Grief can be the loss of anything. It could be you being diagnosed with a debilitating disease and you can't practice dentistry. And that is a sense of a loss of identity. So grief of loss of marriage and the loss of a child. There's so many essence of grief that we fail to recognize. And so, yeah. So I do have a coaching program that people can work one-on-one, and if I can support in any way, I'm happy to.
Yeah, that's amazing that you're doing that. Let's wrap up with two final questions, and you can tell me, where people can find out what you're up to, whether it's a website or social media or about the book. But yeah, let's wrap up with two final questions. Number one is, how do people find out more about what you're up to or contact you? And then the second question, which I love asking, is what advice would you give to the young dentists out there?
So you can find me on my website, parulduamakkar.com, or duagoodjob.com. They're all linked. Instagram, do a good job, or LinkedIn. And then I'm usually very good about responding back to messages. So, if I don't, reach out again. And what would I tell my younger self?
Sure.
I would tell her that you will survive your hardest days, and it will seem like the whole world's collapsed around you, but you will make it through. You're stronger and more resilient. And don't ignore or don't discount the value of time. It's something that is so easily wasted, but it can't be returned, refunded, or replaced in any manner. So just be mindful of how and with whom you spend it with. That I'm still making conscious decisions about it, and more so now than before.
Oh, that's such great advice. Again, Dr. Parul Dua Makkar, thank you so much for joining us. Such a great episode.
Thank you. Thanks so much. This was very, very special. Thank you.
Thank you.
Thanks again for listening to the Stress Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress Free Dentist.